Here's my favorite topic.
Yes, cervical
Vaginal
exams.
exam,
Yes.
which-
So, end of pregnancy. I know a lot of my clients go in for their 36-week appointment. They're getting their Group B strep test, and the doctor says, while I'm down here, let's do a cervical exam.
Often done at the time of GBS screening.
Right.
Group B strep.
And I hate this for my clients because, especially for a first-time mom, there's most likely not going to be anything going on down there at 36 weeks.
So I like my model, that empty toilet paper tube, which is, regardless of the brand, is the length of average vagina.
When you retire, I'm getting you a
I
gold-plated
want
toilet
one
paper
of those.
tube.
And if you squish that tube a little bit, that is really similar to typical vagina. And my hand is considered average size, 7.5, male hand. And to do a proper exam, it requires 2 fingers. And to check for the cervix at 36 weeks for somebody who just happened to be pregnant for the first time without having any contractions, whatnot, it is extremely difficult, uncomfortable, and not helpful. And for all the years I've been practicing, and I'm talking about 30 plus years, I don't do these exams. I don't do it at 36, 37, 38, 39, or 40. Sometimes when asked, I do it. Mm-hmm. And I'm assuming you've never done a vaginal exam on a patient,
I have not
right?
done a vaginal
exam.
exam.
That's right. You're just a doula.
I'm just a doula. That would be a serious crossing the line.
That's right. But when a person is in maybe early labor or a lot of contraction, vaginal exam is much easier. Mm-hmm. Things kind of open up.
Yeah.
But a cervical exam may show that she is 2 centimeters dilated, where almost 2 fingers could be admitted to the cervix, or cervix has thinned out. Mm-hmm. Regardless, it doesn't mean anything.
Right.
That's the point, right? It does not mean anything.
It doesn't mean anything. And it can change so quickly or so slowly. So I think it only has the potential to mentally confuse you or make those last few weeks harder. So I guess the next thing is, do you have to consent to a vaginal exam before you're in labor?
Answer is no. And this is a good place to start saying no to your provider. Mm-hmm. And I'm going to mention down the road about saying no to induction, but you can just politely say, no, I don't want that exam because it's not helpful. Mm-hmm. It really is not helpful. But still a good number of OBs, midwives, and others, I think, routinely do exams as of 36 weeks on a weekly basis.
For cervical exams, at what point during labor are they medically indicated? And when can you say no? When should it be, we really need to do this because it's medically indicated? And how often during labor do you have to have one? So when you get admitted, do you have to have one? Before you get an epidural, do you have to have one? Before you start pushing, do you have to have a cervical exam?
That's a great question. I find less the better. I think upon admission, an exam should be done to see if the patient is in labor, where the starting point is.
Right.
And I think that should be done by the provider because, as you had said, exam varies depending on who's doing it. Once that point is started, then I don't like to do frequent exams.
Right.
I always say I'm butt lazy. Less I do, better the outcome. That applies during pregnancy as well as in labor. So we do an exam upon admission, and if patient feels like, she's in too much pain and needing something, or if it's obvious that patient looks like she's about to have a bowel movement, for example, or she wants an epidural, perhaps indicated. And once patient is in active labor where she is 6 centimeters or more, then she doesn't really need an exam every hour or two. And that's the problem with younger obstetricians and perhaps younger midwives. Having that timeline is what causes problem for everyone.
Right. And I like to talk when I'm teaching classes, when I'm talking with clients, why don't we want frequent vaginal exams? I think a couple of the reasons are anytime anything goes into your vagina, you introduce bacteria.
Or it's uncomfortable.
It's uncomfortable. It can disrupt the flow of labor. So if you're in a good pattern and then you have to stop what you're doing, lie on your back, get a cervical exam, it can disrupt that good flow that you're in. And I also think, again, it doesn't tell you a whole lot except for where you are in that moment. Your cervix doesn't open at a set rate. Things can change very quickly. They can change very slowly. So if you're doing really well, you're laboring well, you get an exam and it's not what you want it to be, again, that can change your mental state and the way that you're coping with labor in a big, big way. So I think all of those reasons are ones to avoid frequent cervical exams.
I don't believe it is necessary. I also don't believe that routine membrane sweep or stripping should be done routinely because it doesn't work. In order to do a good sweep, I mean, when I was a resident, I was told that unless you see good amount of blood at the end of your fingertip, you have not done the sweep. And how many people can tolerate that exam, right? But coming back, I don't think it is necessary.
Yep.
One thing I would say, particularly for the past 10 years, maybe 15, there is this trend of people wanting to change the pathway for pregnancy, right? 40 weeks of pregnancy, people have been pregnant this way, delivered for the longest time. But recently, people are wanting things in a hurry-up manner, mainly with the induction of labor. And often I see patients talking about getting their membrane stripped at 39 weeks. Again, unproductive.